So our next cancer is thyroid cancer, the NM staging. So let's begin with the T stage. So there's T1, T2, T3 and T4. T1 is again divided into T1A and T1B. T3 again divided into T3A, T3B, T4A and T4B. Up to T3A, it is divided based on the size. After T3B, from T3B, there is extrathyroidal extension. So this is less than or equal to 1 centimeter, 1 to 2 centimeters, 2 to less than or equal to 4 centimeters, more than 4 centimeters but limited to thyroid. From T3B, as I have discussed, there is extrathyroidal extension, invasion of strap muscles. Suppose that is hyoid, cysthyroid cartilage, sternum, clavicles. There is invasion of strap muscles, which are sternothyroid, thyrohyoid, sternohyoid and omohyoid. T4A is extension into subcutaneous tissues, larynx, trachea, and one important point is recurrent laryngeal nerve palsy, invasion into RLN. T4B mnemonic is PCM. P is for prevertebral fascia, carotids and mediastinal vessels. Then coming to end stage, it is divided into N0 and N1. N0 is further divided into N0A and N0B. This is unlike any other cancers where there is no subdivision of N0. Thyroid cancer has a subdivision of N0 as well. N1 is again divided into N1A and N1B. N0A is clinically benign lymph nodes. N0B is absence of any evidence of cytological or radiological evidence of lymph nodes. Suppose there's a neck node and we have done an FNEC and it turned out to be benign, then it is considered as N0A. If there are no lymph nodes in either clinically or radiologically, then it is considered as N0B. N1 is level 6 and level 7, that is upper mediastinal lymph nodes. They can be either unilateral, bilateral or contralateral. N1B is involvement of the rest of the neck nodes, levels 1, 2, 3, 4, 5, either unilateral, bilateral or contralateral. M0 is no metastasis, M1 is presence of distant metastasis. Let's see the theory part. T1 is divided into T1A and T1B based on the size, less than or equal to 1 centimeter, 1 to 2 centimeters. T2 is 2 to 4 centimeters, T3 is more than 4 centimeters, T3B is cross extrathyroidal extension but invading only the strap muscles. T4A is cross extrathyroidal extension invading the subcutaneous soft tissues, larynx, trachea, esophagus and RLN, which is the important point. T4B is cross extrathyroidal extension into PCM, prevertebral fascia, carotids and mediastinal vessels. These categories are maybe further subdivided as small s in brackets or m in brackets. S is for if there is only single tumor, m if the tumor is multifocal. The stage depends upon the largest dimension of the tumor. N0 is one or more cytologically or histologically confirmed benign lymph nodes. N0B is there is no evidence. N1A is metastasis to level 6 or level 7. N1B is metastasis to level 1, 2, 3 or 4 or 5, unilateral, bilateral or contralateral or retropharyngeal lymph nodes.